The presentation is entitled Saponin-mediated removal of debris from Bruch's membrane as a treatment option for age-related macular degeneration. I will begin by describing how the normal aging processes impact on photoreceptor viability and discuss advanced aging that can lead to the degenerative changes associated with AMD. The underlying problem in AMD appears to be the accumulation of debris within Bruch's membrane, and in vitro work suggests that surfactant molecules called saponins may be able to disperse these deposits, improving the functional aspects of the membrane. I will then present some pilot data on the potential usefulness of saponins for intervention in AMD. A cross-section of the retina shows the different cell types highlighted in black involved in vision. The visual unit, shown in schematic form on the right, consists of photoreceptors, retinal pigment epithelium, RPE, and Bruch's membrane. The photoreceptor is the detector of light. Photoreceptors require a lot of energy and obtain their nutrients from the blood supply by way of Bruch's membrane and the RPE. Similarly, highly toxic products generated in the photoreceptors and RPE are removed in the opposite direction. The retina also produces a lot of fluids that must be removed across Bruch's membrane. As long as the transport systems in Bruch's remain viable, the photoreceptor remains in a healthy state. We will briefly assess the effect of age on the visual unit. In the young, Bruch's membrane is very thin, allowing easy transport of nutrients and waste products. As we age, debris begins to accumulate in both the RPE and Bruch's membrane. Increased thickness of Bruch's membrane compromises the transport functions of the membrane, but sufficient capacity is present to maintain photoreceptors. In the elderly, the debris accumulation results in a resident low-grade inflammatory response. The thickness of the bidirectional arrows indicates the status of the transport systems. Advanced aging associated with AMD severely reduces the delivery of nutrients and removal of toxic waste products, leading to the death of RPE and photoreceptors. For treatment purposes, we need to reverse these aging changes. In order to do so, we must understand why Bruch thickens with age and identify the nature of the deposits. The extracellular matrix of Bruch's membrane is continuously turned over by coupled processes of synthesis and degradation. The degradation is mediated by matrix metalloproteinase enzymes, of which MMP2 is the most important. As shown in panel A, the turnover of ECM components maintains the integrity of Bruch's. Damaged components are continuously removed and replaced with newly synthesized material. MMPs are secreted into Bruch's as inactive proenzymes and must be activated for matrix breakdown. Following activation, MMPs must be able to diffuse freely to sites of abnormal deposits. With age, the amount of activated MMPs is reduced and their ability to diffuse freely is limited, leading to the thickening of Bruch's membrane. This situation is much advanced in AMD, leading to the gross accumulation of abnormal matrix components. The thickness of Bruch's membrane increases several-fold over a human lifespan and is shown in panel A and the electron micrographs on the right. Due to inefficiency of the MMP system, abnormal collagen accumulates and in the elderly represents about 50% of total collagen. Panel B. The altered collagenous architecture is associated with an exponential increase in deposited lipids. There is also an exponential increase in the toxic retinoid byproduct A2E, which in turn causes further damage to the architecture of Bruch's membrane. Thus, with age, the porous fibrillar matrix of Bruch's is transformed to an expanded, clogged ECM. The impact of this change on transport functions of Bruch's membrane is discussed next. Functional changes have been determined in vitro using donor human eyes. An 8 mm diameter disc of Bruch's is removed and mounted in an assaying chamber. A pressure is applied and fluid crossing the membrane is quantified, allowing the calculation of hydraulic conductivity. As shown in panel A, the hydraulic conductivity of Bruch's decreases exponentially with age, with a half-life of 16 years. That is, the capacity to transport fluids is halved for every 16 years of life. This hydraulic conductivity data is normally presented as a semi-log plot as shown in panel B. Note that these are normal donors, but some of them are already beginning to drift towards the failure threshold. On the hydraulic conductivity plot, the failure threshold, shown here, represents the minimum hydraulic conductivity of Bruch's required to remove the fluid deposited by the RPE. If hydraulic conductivity falls below this threshold, then fluid will accumulate on top of Bruch's, leading to an RPE detachment, and this increases the risk of damage to photoreceptor cells. Such detachments are observed in 12 to 20% of AMD patients. We know that at macular sites of normal subjects, the hydraulic conductivity of Bruch's decreases exponentially with age. This exponential decrease also occurs in the peripheral regions of the fundus, but at a much slower rate. So what's happening in AMD? In AMD, we cannot sample macular regions because of extreme degeneration and presence of scar tissue, but we can sample the peripheral regions. In AMD, this decline in the peripheral regions, as shown by the red circles, is much steeper. We have also examined the age-dependent transport of proteins across Bruch's membrane. Albumin was chosen as a test probe because it is of similar size to most carrier proteins. Aging was associated with an exponential decline in transport with a half-life of 18 years. Transport was severely reduced in samples from AMD donors, as shown by the red dashed line. Can we remove the deposits from Bruch's membrane? Saponins are amphipathic molecules that have a 4 or 5-membered hydrophobic ring backbone and hydrophilic sugar attachments like R3, R1, R2. Note the structural similarity between the saponins and the cholesterol molecule. These saponins can be represented schematically as shown on the right, with a central hydrophobic region flanked by hydrophilic regions. Because of the diversity of sugar attachments, the naturally occurring saponins comprise over 100 species. In the Far East, these saponins are used as nutritional supplements. Amphipathic molecules orient themselves in a specific way at an oil-water interface. Saponins will embed the hydrophobic regions in the oil phase with the sugars in the water phase. Cholesterol and phospholipids do the same. Hydrophobic lipids such as triglycerides and cholesterol esters remain entirely in the oil phase. Saponins can interact with the different lipids such as triglycerides and cholesterol and bring them into solution. That is, they can disperse the lipid deposits shown here. The major lipids found in the deposits of Bruch's membrane are cholesterol, cholesterol esters, triglycerides, and phospholipids. When human Bruch's membrane was incubated with saponins for a period of 12 hours, all classes of lipids were reduced. In particular, the amphipathic lipids such as cholesterol and phospholipids were virtually all removed. Thus, saponins will remove the deposited lipids from Bruch's membrane. Similarly, trapped or aggregated proteins can be dispersed by saponins. The plot shows the perfusion of human Bruch's with saline. Loosely bound or free proteins are initially released. When this release is finished, addition of saponins led to a rapid and copious release of bound and trapped proteins. The release components also included MMP enzymes as shown in the next slide. Zymography is a specialized electrophoretic technique that allows the detection of MMP enzymes, and these are observed as dark bands. FCS is fetal calf serum and contains MMPs 2 and 9. Perfusion of Bruch's membrane with saline, which is in gel A, does not release any trapped MMP enzymes. Perfusion with saponins, gel B, releases MMP enzymes that can kickstart the regeneration of Bruch's membrane. Since saponins can remove lipids and aggregated proteins, can they also improve the transport properties of Bruch's membrane? We have examined Bruch's from human donors aged 15 to 91 years, and a single perfusion of saponins doubled the transport capacity of the membrane. Hence, fluids were more easily transported across Bruch's membrane. We have also examined the effect of saponins on the diffusion of proteins across Bruch's membrane. The diffusional rate was doubled following incubation with saponins. The improvement in transport should facilitate the delivery of nutrients and removal of toxic waste products. Can we use saponins as a treatment option for AMD? We calculate that an oral 200 mg saponin daily dose taken for 2 months should improve the transport properties of Bruch's by 1.5-fold. But can we detect this change clinically? The short answer is yes, using the technique of dark adaptation. The basis of this technique is described briefly. In a normal subject, the efficient transport of retinol across Bruch's membrane bound to its carrier complex and its processing in the RPE provides a large retinoid pool. This pool is mobilized to provide 11 cis retinal to the photoreceptor for regeneration of rhodopsin. The dark-adapted photoreceptor, P1, is full of rhodopsin and therefore very sensitive to light, having threshold A on the dark adaptation graph. A bright flash is delivered that bleaches most of the rhodopsin, P2, making it insensitive to light, i.e. reaching threshold B. Now, the retinoid store in the RPE is mobilized, leading to the transport of 11-cis retinal to begin the rhodopsin regeneration, P3 and P4. The result is a time-dependent improvement in light sensitivity, shown at point C. The fast delivery of 11-cis retinal means that the photoreceptor is fully dark adapted within 30 minutes of the bright light flash, P4. S2 on the dark adaptation curve represents the initial rate of rod recovery. In AMD, the poor rate of transport of retinol across a thickened Bruch's membrane means that the retinoid storage pool in the RPE is low. This pool is low. So, following a bleach, the rate of transfer of 11-cis retinal to the bleached photoreceptor is slow, resulting in a shallow recovery shown on the DA graph here. If saponins improve the transport of retinol across Bruch's, increasing the pull of retinoids in the RPE, then we would expect faster recovery in the rod S2 gradient after treatment. I will briefly describe the method for obtaining dark adaptation curves. A bright flash is delivered to the upper macular region enclosed by the rectangle on the fundus photograph. 7 locations within the rectangle are assessed every minute for light sensitivity, and the average is plotted to obtain the dark adaptation curve shown on the right. For control subjects, the S2 gradient of rod recovery is 2 decibels per minute, this gradient here. A pilot study using 6 AMD patients was then undertaken to assess the effect of saponins on the recovery of light sensitivity following a bright flash. The basal dark adaptation curves for 3 patients are shown on the left. The dark adapted rod threshold prior to the bright flash is shown by the horizontal dashed lines, here, here, and here. At the basal visit, patients A and patients B showed rod recovery, but at a slower rate. Patient C, on the other hand, did not show any recovery up to the 40 minutes examined. The rate of rod recovery in these patients was significantly slowed compared to the controls, shown here. After 2 months on saponin treatment, the rate of rod recovery was significantly improved, indicating better transport across Bruch's membrane. Improved transport is expected to facilitate entry of nutrients, vitamins, and antioxidants, and at the same time remove toxic products. The net result is expected to slow or reverse the degenerative changes in AMD. These initial results are encouraging for the development of a saponin-mediated treatment protocol for AMD. A small, placebo-controlled, double-blind trial is due for completion by the end of this year. A much larger trial is expected to start in the UK next year. I thank the organizers for the opportunity to present our preliminary data. Thank you.